This past week, an Indian pharmaceutical company made headlines for all the wrong reasons. It was reported that the company manufactured cough syrups, which were responsible for the deaths of 69 children in the African nation of Gambia. In this video, we, at Biscool India, explore this debacle surrounding a cough syrup, which tarnished our country's image internationally in more detail. The company involved in this entire issue goes by the name Maiden Pharmaceuticals. Evidently, the cough syrups manufactured by this company comprised of preservatives at extremely dangerous levels. As we all know, preservatives are added in almost all items today to increase the longevity of the product, and the same thing goes for cough syrups in question. However, too much of everything can do more harm than good, which it did in this case, with preservatives like diethylene glycol and ethylene glycol. When consumed in excess quantity, these preservatives affect the functioning of the brain and the kidney. In extreme cases, they prove to be fatal, which unfortunately turned out to be for 69 children in this case. For the record, this entire situation is currently an allegation towards Maiden Pharma. Investigations are ongoing which surely will result in evidence either proving the guilt or the innocence of the company involved. However, the allegation nonetheless has created a huge storm. If we go by past media reports, Maiden Pharma seems to have supplied substandard medicinal drugs, for which it was outed by the government of Bihar back in 2011. Even the governments of Kerala and Gujarat have raised issues on similar lines against the company, a total of 6 times in the preceding 9 years. The company has fared poorly in the international market as well, having been blacklisted from Vietnam in 2014, alongside 38 other organizations for flouting drug quality standards. With this bad of a track record, the evident question to ask is, how was Maiden Pharma allowed to operate for so long? To start with, people are scrutinizing, right at the very top, approvals from regulatory bodies. You see, anybody cannot simply go and sell a drug within the country. For marketing of drugs, one first needs to obtain necessary approvals from the Central Drug Standard Control Organization, known as CDSCO, in short. This organization comes under the ambit of Ministry of Health and Family Welfare. Alongside it, other state regulators also exist, which assist in providing necessary licenses to companies to manufacture and distribute drugs. Maiden Pharma has all the necessary approvals, both from the central regulator as well as the state regulatory bodies. And these licenses have been valid throughout, even during the preceding years of allegations against the company, not being revoked, even once. Another question which arises is, since the issue is being raised in a foreign country, an international regulator must also have been involved. You see, for drugs exported to other countries, the World Health Organization or WHO oversees compliance. WHO is responsible for handing a Certificate of Good Manufacturing Practice, or GMP in short, to anyone wishing to export medicinal drugs to foreign destinations. For the task of individual inspection of a company's manufacturing process, whether necessary safety and quality control checks are in place, that onus is left to the local regulatory bodies. As long as Maiden Pharma had the license from the central regulator, specifically the Certificate of Pharmaceutical Product, they were good to go. In fact, Maiden Pharma was even listed as WHO GMP compliant on CDSCO website. This may indeed point towards regulatory lapses having in fact taken place, if the allegations do turn out to be true. And hence, we come back to the potential reputational loss for India. The Indian pharmaceutical industry has made giant strides in drug manufacturing in the previous decades, earning India the nickname of Pharmacy of the World. We are the largest global supplier of generic drugs and the third largest medicine manufacturer in the world by volume. All these efforts can be undermined by such allegations and scandals. What do you think? Does India need to undertake reforms at the regulatory level itself? Do let us know in the comments below. If you found our video useful, please do leave a like and share it amongst your family and friends. Subscribe to our channel for more informative videos in the future. See you until next time on a new topic.